COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Guys, we're in the middle of the pandemic and these are trying times. It's hard on our mental health, our mental state, and this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees. Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Quack Nation! Yes, welcome back. We have a special episode today. A friend of mine who I haven't seen in over a decade, orthopedic surgeon, specializes in sports medicine, done I don't know how many fellowships, but he is currently in Houston, Texas, but did a lot of training in El Paso and really got to experience COVID firsthand within Texas. And I think there was a lot of lessons we could hear about in terms of the COVID experience that they had in Texas and deal with some of the misconceptions, like, for example, that it's wide open in that state, that nobody's using any restrictions. I think this was a very valuable conversation to have the book perspective into things. We also talk about his experience with the El Paso mass shooting. I'll tell you, he got me verklempt talking about this and the stories that they were seeing, but hearing how his team rallied together and the community rallied together to get them through this. It really is a special episode. I hope you guys enjoy it. Before jumping into it, solvingwellness.com. You're a healthcare provider, join our community, yo. We're really doing stuff to try and reduce burnout amongst our healthcare providers so we can provide the optimal care for our patients. So yes, we got yoga, we got fitness classes, we got cooking classes, we got nutrition tips, stress management, you know what I'm saying? Productivity advice. We do it all. And the real beautiful thing is you get that sense of community. We're in it together. $9.99 for the year, $9.99 per month. But you know what? First month is free. This bad boy is glorious. Solvingwellness.com. Check it out. Anyways, without further ado, we're going to bring Billy in the mix. Dr. Bill Weiss. Enjoy this. Quadcast Nation, I'm bringing back a blast from the past, a personal blast from the past. We got Dr. Bill Weiss all the way down from Houston, Texas. And I'm really excited because Bill, when was the last time we seen each other?
In person, it was probably like 2011, 2012, right before I left.
Oh my goodness. So like 10 years.
It's been like 10 years. Yeah.
Those that are,
we see each other on social media all the time, but that's it.
Yeah. I seen you busting out some Offspring.
Yeah. You too.
It's been crazy, but it is absolutely awesome to see you, buddy.
You too.
And so Bill reached out, as you can imagine, being down south, his experience with COVID has been a unique one. But first, maybe Billy, let's get into like how you landed in Texas. Like, what was the journey out there?
Yeah. So, you and I know each other from our days in O-Town in Ottawa. We were residents together. You were my senior on the ICU. And as I said, we have a story at the end that I'll save it. But then I was trying to figure out what to do, and I got a fellowship out in Alberta. So I packed up my car, I left Ottawa, went to Edmonton and spent a year there, and then had a great opportunity to go to Dallas through Don Johnson, one of our sports mentors in Ottawa. I had a great friend, Alan Barber, in Dallas, Texas, who I was his last fellow, which is pretty special. So I packed up my car, drove to Texas, and I really liked it. And I did my fellowship. And then I looked back homeward to try to find a job, and I couldn't find anything. And so I looked around and scrambled, and I found a fellowship here at University of Texas Medical Branch, which is where I currently work in foot and ankle. And I took that and came down here for a year. And so now we're getting into 2016. So I graduated 2012. I'm fellowshipping now for 4 years, can't find a job. And I came down to UTMB and did my fellowship here, and again, looked north to try to find a job. And there was nothing. I actually spent 3 months living at my mom's house on her couch because I got nothing. And so El Paso, Texas came a calling and said, well, we have a residency program that is the only military and civilian orthopedic residency program in the country, and any residency program. But we need help. Come on down to El Paso and do sports for us, teach our residents that are military. So I took that and I went to El Paso, Texas, which is the far west point of Texas. Very multicultural city, 90% Hispanic. I didn't speak a lick of Spanish, as you can imagine, but it's remarkably similar to French. And I was able to get by and learn some, and great people, wonderful experience. And I spent about 5 years working in El Paso, getting my green card and all that set up, because I came into the US as a physician that was a student. There are restrictions on what I can and can't do. So once I was able to do that, the UTMB here, we had always kept in touch, and they had basically left an open invitation that said, Bill, when you can come, we want to keep you. And I let them know that, hey, I can come now. And they said, okay. And right in the middle of COVID, the peak of COVID, I got a new job and moved back to Houston, Galveston, which is unusual because not too many people were hiring. People were getting laid off, as you know, around this time. And somehow they managed to just say, okay, well, come on, we're taking you. So that's what brought me here. I was the director of research in sports medicine at Texas Tech, El Paso for a while, but it was a very small group that was 9. And then when I left, I left only 3 colleagues there. And we can talk about that with relation to that and the shooting in El Paso and everything later. And I joined a great group here at UTMB where they charged me with building a sports program to help them get, our brand and our sports people onto the mainland, as well as around Galveston and into the Houston area. So it's a great opportunity, great place. I'm very happy live on an island. It's great.
Wow. What a journey, Bill. I still think like a lot of people don't realize as an orthopedic surgeon, the kind of journey you have to go through to try and get a job. Like, think about this. How many fellowships you end up having?
I ended up doing 3 fellowships. So my graduating class was 5 orthopedic residents. And I think 2 or 3 of us were lucky enough to get a job right out of the gates. But 2 of those have now switched and moved. And one of them is in the US here with me. The other moved across the country. One, it remains on the East Coast, and the other is in the West Coast, but has also moved jobs. And it took me from 2012 to 2016 to find a job. Now there are jobs, but there were no jobs that I felt, with my level of training and what I wanted to do that were appropriate. I could have come back and worked in small town Ontario, probably, but that's not what I wanted. And after 3 fellowships, I wanted to do sports medicine and trauma, and in a small community, I'm not going to get to do a lot of that. So that's a big factor that we talk about at the Orthopedic Association. I'm still a board member of the Canadian Orthopedic Association and the editor of one of our journals. I'm the current events editor. So I'm still very involved in Canada and what goes on in Canada, and very up to date with orthopedics in Canada.
But I don't want to go off too much on a tangent, but like the amount of training, you go this far, damn straight you're going to do a job that you want to do, man.
Yeah,
like
9 years after med school.
Like legit, and the skill set, like you don't want those skills to dampen. So no, I completely appreciate what you're doing, but we need to, that's another show.
Yeah, it's a whole other show, and it's still a problem, and a bigger problem now after COVID, I'll tell you.
No, for sure. So yeah, COVID, man, like you got the Texas angle on this bad boy.
Yeah.
And I mean, where to start? Like, like, what was it like, say, even in the beginning phases? Like, I guess you would have been in El Paso in the first wave.
I was, yeah. I'll take you back when it started. I was in El Paso, and just like everywhere else, things were, typical. Infections were rising. People were worried, blah, 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 blah. And we in March 2020 went into, a phase where we stopped elective surgery for a period, which, made me a trauma surgeon essentially for the next 3 weeks. And again, we were a small group. So, we had one guy that did hand and we had a hand call. We had one guy that did peds and did peds call. And then we had a trauma guy who did the trauma call. And I was the guy that filled in. I did trauma call. I did peds call. I did hand call. And so when the elective problem happened, I was really the only one largely affected because most of my practice was supposed to be elective, but it became peds trauma, adult trauma, hand, whatever. So that was a big change for me. But, we rode that out just like everyone else. And going into the summer of this last year, things were fine. But then, as you know, things changed and El Paso became the hotspot. And I recently just reviewed some stuff, but right now, Texas is not even in the top 10 in states that have number of infections. But at that time, we were considered the hotspot. We had some of the biggest case loads in all of the United States at a while in El Paso, probably approaching late August, September. So things changed a lot then. We had 10 refrigerator trucks come into town for bodies, and they were parked outside. And that was a big deal in the news. 10 trucks, because we were overflowing. Our morgues were overflowing. We had tents in front of every hospital starting in the summer that remained throughout that. And it was a huge deal. We took on at the peak, we have a capacity in the El Paso region of about 300 ICU beds, and we filled them up. And I found some numbers today just looking, but, in the end of October, we had 200 ICU patients and 100 of them on ventilators. And by November, we had maxed out and had 300 ICU beds full, and 250 of those were ventilated. So like our capacity in that region was full. We were sending patients to San Antonio and Dallas to just get people care because we were full. And I guess the question that, we can talk about is why did El Paso get hit like that? Why were we a hotspot? Why were we, NBC News called us like a disaster zone? Like, this is the worst case scenario. It's happening in El Paso right now.
Did it feel like it? Bill, like, like sometimes like, you're surrounded by this chaos, but sometimes it's not as advertised, but like,
yeah, we felt it. I mean, we knew even at the beginning, we went into a lockdown as well. And, I remember our trauma director telling us to keep a lab coat in our car just in case you were out and someone pulled you over, you could show them that, no, I'm going to work kind of thing. And so we felt it. And me particularly being an elective surgeon, all that stopped. So, all my sports patients went away, all my sports surgeries went away. And what I did was trauma call and trauma surgery. So for me, I felt it, and we knew stuff was different, but then it went to another level come the end of summer into the fall. And, then we started talking about redeployments and stuff like you've seen in other places. And as probably the one guy in our group that was not linked to a trauma service directly, I was probably the guy that would have gotten sent away, but because we were only 4, we couldn't really afford to send people elsewhere. I mean, if I was out of the loop for ortho, then now they're 3, and that's a lot of coverage. El Paso is, just to take you a step back. I mean, El Paso is about 1 million people. There's a city up the road about 20 minutes called Las Cruces that's about another 500,000 people. And then right across the border in Mexico is Juarez. That's our sister city. And they're like 3 to 4 million people. And we are the only level 1 trauma center for 300 miles. So we're covering like 5 to 6 million people. And you only have 4 orthopedic surgeons at the level 1. So, we're busy, and taking one person out of that rotation really affects the group. So, so fortunately the group could not be broken up, and I didn't have to be redeployed to the ICU or something where, as you've heard the stories and I'm sure seen the stories yourself. I mean, we had a whole other ICU for COVID patients. We had, nurses coming and going and physicians, and we had the military helping us out in El Paso. We turned our convention center into a hospital to back up with all the tents that we had. So it was a huge deal. There was definitely a change in the fall that you noticed that things are bad. The parking lots were now tent hospitals. There were morgue trucks in the parking lots, and things were nasty.
That must have been like like you guys were the news that we were fearing. Like
we were the worst case scenario a few months after New York. And I mean, if you go on YouTube and Google El Paso COVID, there's like 10 NBC nightly news and CBC nightly news top stories, El Paso, the crisis, blah, 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 COVID in El Paso. And we were the hotspot in the entire world for a while.
And, you mentioned it's 90% Hispanic, and we talked many a times, like you got it sounded like you got to listen to the episode with Dennis Kim about his experience in LA County there. But like it's clear, even in Ontario, socioeconomics is a huge impact, multi-generational homes, huge impact.
That's exactly what we saw.
That's what you saw.
80 to 90% of the population of El Paso is Hispanic, but also 90% of the victims of COVID were Hispanic. And it is a simple numbers game, maybe, but there definitely was talk of, the multi-generational houses and stuff like that. I mean, I know families, and again, on those news stories, you see the families who had like 6 family members pass away from COVID because they were all linked. And, the Hispanic culture is very much centered about family. And so, holidays and stuff, that's what they do, is they get together and they hang out and spend time together. And that's hugely important in their culture. And that's, one of the main, I think, factors that drove the infection in El Paso is that, you live and you spend your time with family.
And what was, we talked about it a little bit, Bill, but like, what was some of the restrictions that was happening within like El Paso or Texas? Because you're having certain levels of lockdown.
That's a very, very difficult question to answer, and it changed at various times. And Texas itself as a whole tried to remain largely open, which I'm sure you remember. But and this was one of the issues in El Paso, is that the El Paso mayor said, no, we're having a problem. We need to shut down and lock down. And so there was a huge political battle between the mayor and the state saying, stay open, businesses, blah, 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 and no, shut down and people are dying. So that went back and forth. So El Paso went through many phases of lockdown, shutdowns, even a curfew for a period of time where, no one was allowed out after 9 p.m. or 8 p.m. Mm-hmm. So it was very variable. And one of the things that did happen is within the restaurant and bar industry, restaurants were allowed to stay open and bars were not, unless 50% of their income was from food. And so what you saw is that some bars were, pushing food and selling drinks based on food. And so a lot of them were able to sneak in under this restaurant title and remain somewhat open. And we think that's part of why it got so bad is, we still had contact in the community, within families, within restaurants, even though they were at limited capacity. And then there was an ongoing political battle, which, as any city that's undergoing a political upheaval like that, people are going to take sides and not listen. And that's what happened. The other side of it is the proximity to Juarez. And even though the borders were closed, there are many U.S. citizens that cross that border every day. And so people were coming and going regardless of closed borders. So, how many people would go to Juarez and come back with an infection? And I can tell you, watching the numbers around that time, we would be seeing numbers of, 50 infections a day, 100 infections a day in El Paso, maybe 1 or 2 deaths in El Paso. But then you look at the numbers from Juarez and they don't have the capability to test. So they would report deaths, and they're reporting like 100 deaths in a day and like 10 infections. And so,
a city of 3 million.
Yeah, exactly. So that something is going on there. There's way more infections than we can appreciate. And the numbers of death alone are telling you that the infection is rampant over there. So these people are coming back and forth. And one of the things that happens a lot in El Paso and Juarez is when something is bad over there, they will bring it to the border, especially if it's a U.S. citizen, and basically do an ambulance drop and say, hey, we got a guy who's got this, come pick him up, take him to your center. And so these guys would probably do that once or twice a day, the ambulance attendants, guys and gals. And we would get trauma, we would get infections, blah, 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 bad stuff. But during that period, they were going to the border like 10 times a day to pick up people in respiratory distress who most likely had COVID, but hadn't been tested, and bringing them in and taking them to UMC and trying to help them. But the border drops, as we called them, went up significantly during that period. So the proximity to the border is a big player here. And El Paso Juarez is one of the biggest it is the biggest multinational and multilingual community in the world. definitely in the Western Hemisphere. And I think there was a lot of that at play that really contributed.
Yeah, I mean, 2 points. Obviously, the politicalization of COVID is one of the Achilles heels because honestly, it doesn't allow you to follow the data, doesn't allow you to follow the science, which is detriment to so many. It costs lives as far as I'm concerned.
Absolutely.
The second thing that I hear when it comes to response is the importance of like that regional approach. Like maybe the situation, I mean, I don't know, maybe the situation in Houston or Dallas was maybe different, but El Paso sounded like was on fire.
Yeah, I think that's the point right there, is that El Paso is not Dallas. El Paso is not Houston. It is still Texas, but it is very different.
Yeah, because we saw that clearly in Ontario. I mean, throughout, I'm certain in a lot of areas within Canada, but in Ontario, the GTA, specifically like Scarborough, Peel, were like on fire.
Yeah.
Whereas in Kingston, Timmins, even Ottawa to a certain degree, for a large part of, depending on which wave you're talking about, we were okay. Mm-hmm. But it's just, it really goes to show how important it is to kind of think about what is that region doing? What are the resources that are needed to keep things under control? Like, do you feel, Bill, like the resources were being funneled to El Paso? Like they were
once things were starting to peak. Yes, Texas and the United States did funnel resources there, and that included like traveling nurse type people who would come in and take care of people, and as well physicians, and particularly El Paso has a very large military component. It has one of the biggest Army bases in the U.S. And so Army physicians that I worked closely with there, they were being deployed to come and help. So there was definitely a funneling of resources, but maybe not an address to the problem, which I know you guys have hit on, which is largely the socioeconomic factors, I think, that play into this. And I mean, that doesn't change overnight, obviously, but that's one of the things that I think made El Paso particularly vulnerable. Most of the people there don't have insurance, and they're really limited in seeking care because of that. And even though there are programs to help them in El Paso, because we know that, a lot of them won't do it because they know it costs money and they can't afford it, and so they wait until the last minute, and then oftentimes it's too late, as you know very well.
Absolutely. And then also, like, how are you going to take time off work? I'm sure being in Texas, there's no paid. I would imagine there's no paid leave.
There are programs, but most of these people don't have access to them because a lot of them work jobs that are under the table. I mean, they work for cash.
Yeah, no, that's a very good point. And so, like, just walking through that time. So that's the fall. Did things get better, like over the past fall, winter into 2021?
Yeah. So I left El Paso in late October of last year, kind of right at the peak, honestly. And, I will say that it didn't really feel great to leave my colleagues at that time, but for me and my family, this was a better opportunity and something that we'd always pushed for, and it was able to happen, and UTMB was able to make it happen. So we went, but yeah, that was around the peak. And so going into November, that's those numbers I was telling you when we kind of maxed out the ICU beds. We struggled there, but they made it through. And after that, things started to decline, and things are now a lot better there. The case rates are down, but the case rates don't mean much, but the ICU admissions, the people on ventilators have all come down significantly, and now are more in line with the rest of the United States, which generally is doing well. And the interesting thing about Texas that I know you probably wanted to discuss is that we opened relatively early, and we've gone to, a state where we're calling it open, but I'll tell you that here in Galveston, and I know in El Paso too, people are still wearing masks. So my institution, while we don't require masks in our outpatient clinical settings, we still require masks in hospital settings in our 5 hospitals. So while we're open, but we're not back to normal. We're definitely still masking. We're definitely still distancing. People are still being careful. My institution has given over 200,000 vaccines itself. Our vaccination rates, when we look between the two, Canada has really pushed the first vaccine, and you're, I think, approaching 70% now, which is great. Texas is about 50% fully vaccinated. We don't have as many one-timers as you do, and there's a little more resistance, I think, in the US to vaccines, but we're over 50% one-times and over 50% 2 times, so fully vaccinated. And I think that's why it's been successful, is we have a very large vaccination program that has been widespread, and we're getting to the point where they think we may reach herd immunity by the end of the summer. So even though we're open, we're still being careful, and we have precautions in place. And Galveston County, where I live now, I just looked today because I knew it would come up. We reported 6 new cases of COVID in the entire county, which is a huge county, part of Southern Houston and everything below that. And we have only 300 active cases.
So that's if it's includes all of Houston.
It doesn't include all of Houston.
Oh, okay.
Houston is a separate county. Galveston County is kind of part of South Houston, and then down onto the island, which is in the Gulf of Mexico.
Well, either way,
but Houston itself has always also been pretty good. Probably would report similar numbers. I didn't look them up though.
No, absolutely. And just this timestamp at people, we're doing this on June 30th, 2021.
Yeah.
So I think you brought up some really important points, because I think the perception when you think of Texas is that everything is wide open. And
it's Wild West.
Yeah. And that, because Alberta, as of tomorrow, no restrictions, like back to normal.
Yeah.
And so when you say outside the hospital setting though, is there any mandates for anything? Like, do you have to be
No, there are not mandates, and government in the United States and Texas in particular is different. And, there's state and local, and the state has basically, and this was one of the things in El Paso, maintained, no, we're not closing. We're not doing crazy things. We're life as normal. So the state is still towing that line. And so everything is open. However, what you see is that not just hospitals, but many businesses are also requiring masks still. And I would say it's probably 50-50. There's 50-50 businesses that are still requiring masks and distancing, and 50-50 people that, if you look around, are still wearing masks inside, and 50% are not. So it is still a mix. It's still happening, and not to the degree that it was, but people are still being careful, even though we're more than 50% completely vaccinated as well.
And as you mentioned, cases remain low.
Yeah. Even since the opening they have. And I know you guys saw, early on, like the Texas Rangers had a game and it was full. And people were freaking out about it, and rightfully so. And in Canada, the hockey playoffs, there's nobody in the stands. So, that was a big, stark difference. And so far, knock on wood, things continue to be good, given that people are being smart, I think, and listening, within reason. Although, as up there, not everybody believes that masks are useful, and not everybody believes in vaccines, and to some degree, that's their opinion. That we don't need to get into, because I know you and I agree on these things, but that's what's happening.
No, I think this is really golden information, because once again, I think the perception is not necessarily reality, at least from what you're seeing there. And I think this is important.
Yeah. To speak specifically to, I know things that are happening there is our schools were open to finish much of the year, and our kids were in school. And I know that's an ongoing issue that mutual friends of ours are active in with the Ontario physicians groups. We had open schools for a while. There were sports at schools. Things are happening, and nothing has gotten crazy here. We're still here. We're still Texas, and, we still have people.
Yeah, no, I don't want to get into the school thing, because it breaks.
Yeah, I know it's a big hot button issue, but yeah.
But I want to say it's nice to see that, in terms of the values that Texas has established, they're gonna do what's best for their kids. And
it is partly that, but it's also, as you know, partly Texas, and Texas is a very unique state in that, they're kind of I'm going to do what I want to do state, and if you don't like it, that's fine with us. And that's the way Texas has always been and always will be. And it's good in many ways. And yes, we said, no, we're not going to do that anymore. We're going to open and do these things. And fortunately, it has worked out. But I think the credit goes to the people that, made sure everybody had the vaccine as much as possible, and the people that continue to still be careful.
Yeah, no, very good points, Bill. I want to ask you, I haven't been able to get this out of my mind, so I just want to, this might come out of left field. How do you feel about this job situation? Like doing all this shit, training in Canada, like being born and bred, and, not being able to find that job.
Yeah.
It's
disappointing. I mean, like, I love Canada. I love hockey and Canadian football, and I love Alberta, and nothing would make me happier than to go and live in Alberta and do orthopedics in Edmonton or something like that. Yeah. And it's very disappointing that isn't really in the cards. It's something that I told you I was still part of the Canadian Orthopedic Association. I'm the editor of current events for our bulletin that comes out quarterly. And I mean, it's still a big issue that we talk about all the time is, the job numbers are not up. And this is now getting into my opinion, but my opinion is that the system just can't support that many surgeons, and we need them. I mean, there's work. Demand is there. There's demand, but the system doesn't want to pay for them or can't pay for them. And that's really the issue. And that's what's limiting the hiring back of our own home trained, home bred and born surgeons. It's just that the system can't bring us back. And so a lot of us bounce to the US, and, the truth is life here is not that different from up there. And so some of us say, okay, I'm just going to stay. I mean, like I told you off camera, like I can do anything here. I can do shoulders, knees, hips, foot and ankle, trauma. I do it all. And I like that. In Canada, when I had opportunities to interview for jobs, it was rural general orthopedics, or we need you to be our knee guy. But that's all you're going to be able to do because we can't afford to have other things. So it's very frustrating, and it's still a problem. And now, because of COVID, there is a huge backlog of what's now considered lifestyle type surgeries. A lot of what we do, what I do, that needs to be done. And I mean, I don't even know. I saw an estimate that we were 3 to 4 years behind up there now in terms of like knee replacements, ACLs, stuff like that. Not life or death, granted, but lifestyle surgery. People need this. So, I mean, that's something that's coming to the forefront now, but it's frustrating. And, I guess I'm over it now, but, and I'm happy in Texas.
I just couldn't, I had trouble shaking it because I'm like, we're boys. I haven't seen you in 10 years. And I'm thinking, man.
Well, I never intended to stay. I tell people all the time, I thought I was going to come down for a 1-year fellowship and go back home. And it just never worked out. I never intended to stay. And that's why it was so hard for me to stay. Yeah. But it was not the intention.
It just breaks my soul a little bit that we there isn't a way, but I mean, once again, I think there's going to need to be some creative options when it comes to these, the amount of
I'll tell you what
demands.
I think. I mean, this now we're making this a multinational community. And so now our orthopedic community, I'm in there and doing stuff, and I'm in Texas. So now we have a voice in Texas, and I know there's voices in Michigan and other states. So now we've gone from a Canadian orthopedic group to a Canadian orthopedic group that is now spread all over North America. And so we can draw on that. And I think use lessons, again, going back to things that happened down here, like that El Paso shooting I was involved with, that doesn't happen in Canada, but that's something that, I can come back to the COA and say, listen, this is what we learned from my experience. Let's look at what we've done in Canada. And we did that in one of our issues. I wrote a follow-up article to something Alan Liu from Ottawa wrote about the bus accident that was happening in Ottawa there a few years ago. And so I wrote a similar paper about, what happened in El Paso and what we can learn from it, what we can all do to have, more preparation for these sorts of events as they become more frequent.
Yeah, man. Like just to have that added perspective. And I'm going to say hi to Alan for you, actually.
You should, definitely.
I see him in Tremblant all the time.
Yeah, I know. He's a big
great
skier.
Family. Yeah,
yeah, he is. They're growing too.
Oh my goodness. But I mean, we can't not talk about that El Paso shooting, like what that was like to experience. And like, especially once again, being a Canadian where, for me, I mean, I'll speak for myself. Like
Dennis built this up.
Yeah, exactly.
How many gunshot wounds did you and Dennis see?
Yeah, exactly. Like,
I saw probably 2 in my 5 to 6 years of residency and fellowship.
Oh man, being at the trauma center, still, I'll say maybe I've seen in 15 years half a dozen, where I was actually involved in. But man,
I'll tell you that I saw more gunshot wounds in my first month in El Paso than I did in my entire career to that point.
Like, honestly, that must have been.
It's a big change.
Yeah. And whether you want to talk about just seeing the gun violence in general or the El Paso situation, or the mass shooting.
I mean, it's related. We do see a lot more violence. It's not as bad as it used to be. There was a time when El Paso was very violent when the cartel wars were going on. And it wasn't so much El Paso, it was across the border, but it would come to us for treatment. But that has declined significantly. The shooting was obviously out of the blue and, not something you can ever prepare for. But I was actually on leave still from the birth of one of my sons. And, I got a text message from our director saying, hey, if you're in town, something's happening, head to the hospital. And I was like, oh man, that's not good. And so I went in, I went to my wife and I said, hey, look, I think I got to go. Something's up. And she was like, yeah, okay, go. So I went in and nobody was there at that point. The shooting started at like 10:40 in the morning. I think I got the message at like 10:45, 10:50. I got there and I went immediately to the OR because I knew our trauma surgeon was on call. I went into his OR and said, hey, what's up? And he hadn't even heard about it. He was in a case doing a hip nail. And he was like, I don't know what's up. The junior got called to the emergency department. He hasn't come back yet. So they didn't even know. So I said, okay, well, I'm going to go to the ED and see what's up. So I went out of the OR and to the ED, which is obviously right beside it as usual. And I mean, it was chaos. The first patient arrived without any warning. She was picked up by somebody in a car. She was shielding her kid who was covered in blood. And they just dropped her off at the ED door and she literally walked in. And about 10 minutes later, she was dead. She had a massive wound in her shoulder that our trauma surgeon tried and he couldn't save her. And so that just started it. There were 3 patients that walked in from civilian vehicles, no triage, no treatment, except for basic first aid from a bystander, dropped off at the door and in they come. And so the ED is figuring out that, hey, something is happening. So I immediately, saw one of the general surgery residents that knows me and she said, hey, Dr. Weiss, I got 3 patients I need you to see. And I was like, okay, let's go. And so we went and saw 3 trauma patients and kind of evaluated them together. There were 2 of my residents there and one of our nurses was working the ED. So they were also seeing patients, found me. And so we just started to put together a list of like, here's who we've seen. This is what's up. They need to go to the OR. They don't, because nothing had happened. These people were just dropped at the door. So we kind of created a multidisciplinary team and looked at all the patients in the ED and then decided, surgery or no, monitor, wait, re-triage. And so we have a program there that is the only joint military and civilian program in the United States in any way, but it's orthopedic. So 90% of our residents are military surgeons. So they responded, of course, the call went out and, they all dropped everything. And there were like 10 of us, including our civilian residents as well, that just descended on the University Medical Center and started seeing patients and doing stuff. And my trauma colleague was already there on call. 2 of our other colleagues who were in town also came in. We were 9 surgeons at that time in ortho, but only 4 of us were in town and all of us came in just to try to help. And that day I think we did 4 or 5 surgeries. All of us did a few. And then over the course of the next week, these patients went in and out of the OR, obviously. It was crazy. I mean, I said in the article, and I tell everybody, it's not something you ever want to be a part of, but, I was glad that I could be there and help and do something. And these situations are always very fluid. You just, they don't work like the textbooks. And that's what I think is the main takeaway points, is preparing to have abnormal situations and practicing and then being fluid. When you don't get that field triage and you don't get the pre-treatment from the ambulance before the patient arrives, you got to start from square one and you go from there.
Man, I got so many things to say, but just to that latter point, because I don't know if this is really emphasized in medical training about that being agile and fluid. Cause like
it is not,
you see, I mean, I come from internal medicine, man. Like when something's not textbook, you can see the wheels start to swarm. I don't even know if that's another.
Well, so now just today, we had a discussion in our academic session on disaster management because it needs to be part of our curriculum. And in orthopedics, it's not. Mm-hmm. So we had literally a talk today from one of our military residents here. He's from the Air Force and he gave a talk on just general disaster management, which needs to be discussed at all levels of medicine because it's not just ortho, internal medicine, general surgery, plastics, ENT, we all were there. Mm-hmm. So we need that help.
100%. Because I mean, not only like, yes, disaster management, but also having that mindset of like, how do you, like, is there a framework for being agile? Like, where are you going to put your energy? Are you able to triage in the moment? like knowing that you're not going to give somebody necessarily the optimal care that they would normally receive if you had more time and resources. Like this is a lot of like I don't even know how you would teach
this is triage.
Yeah.
And that's what it comes down to is, looking at your resources that you have available and using them effectively for the greatest outcome. And being in a hospital setting, we have lots of resources, whereas in the field, they don't. And, I guess that's where triage needs to be flexible, because in the field, it might be all about transport. And if you don't have transport, then you got to get the sickest people that you can save transported. But in the hospital, you're there. And then the resources become OR time and blood, for example. Like we went through 110 units of blood that day.
Oh my
there are resources you need to think about and manage to optimize your outcomes. And it is a very different mindset from what you and I usually practice, which is to save everybody, because that's our goal. But in this kind of scenario, you have to start thinking, well, I can't save that person, or the resources to save that person are too much. And that's really something that we are not familiar with from a civilian medical training. The military guys do get some of that, but even for them, it's not easy to, decide that I'm going to save Jimmy and not Johnny, because Johnny is too resource heavy for us right now. We can't bag him while we transport him, for example. So, that takes up a man.
Wow. Like that must have been like, what was your headspace at during like when you walk through the door? Like, cause I can speak personally that often when you're in those moments, you're not really thinking, like you're just totally into
you're just
it.
Doing.
You're totally full.
Yeah. I think that's what it was. It was like, it was like game day. It was like, you're not thinking, you're just like, okay, well, you don't think about what's happening. You just know that this is in front of you, and what can we do about this? Okay, do it. And okay, what's next? Let's do that. You just go into that mode, which we all have, of you're just focused on what you can do to make the best out of a bad situation and not thinking too much about the rest of it. And, my trauma director there, he was unfortunately not there at the time. He was on a plane to get back to El Paso. And then he got back to El Paso that day, and he ran around and, did all the things that directors do. And then he tells us the story, because we had a lot of breakdowns about this afterwards, the impact of it on us and talks. And he literally on the drive home saw a sign that said El Paso Strong, and had to pull over because he said, I just broke out into tears. And I mean, you don't have time to process it in the moment. You just do. And then later is when you process. And that was, something that we also talked a lot about. We have a trauma conference every year that year was almost entirely about this event and events like it, and how to deal with it and what to do, and the impact that it has on all of us, the community, but the physicians and nurses and the staff in the hospital who are in there, cleaning up the blood, turning over the rooms, restocking the shelves so that the next one can come in. I mean, they're just as much a part of that as any of us.
Yeah. And what was like the post shooting response within the teams? Was there a lot of like, burnout or like negative impact that way?
I don't think there was a lot of negative impact, but burnout was definitely something we talked about, and definitely something that impacted us all, especially as a small orthopedic group. We, with only 4 of us, all of us were involved, and, all of us were taking care of these patients, but there was definitely, a factor. And that's one of the resources you need to think about, is not just, restocking the bandages and the dressings, but your personal resources, your people, that get worked over by this and need to recover. I mean, this is not a sprint, it's a marathon, and, people get tired. And so we talked a lot about that. We had meetings with the residents and staff all together, like open forums, just to talk. And, a lot of the emergency residents spoke up about what they saw that day and how they weren't expecting it, and the impact that it had on them. And our trauma surgeon who treated that woman I told you about, who came in at the beginning, he actually presented to Congress on it and the impact that it had on him. And this was a high powered rifle. So a lot of it was focused on, high powered rifles and how maybe those shouldn't be available to the public. And so there was definitely a lot of fallout and burnout type discussions. And then, the poor thing for El Paso was that we got through that, and literally a year to the day, then we started to ramp up our COVID. And so El Paso suffered that second hit. And so the physicians in El Paso are certainly, exhausted and overworked and just tired of facing these dire situations.
Wow. I mean, honestly, I couldn't imagine, especially like that's going to be long lasting impact on the citizens of El Paso and on the staff. In your opinion, Bill, was there any change or like a positive that came out of any of this kind of chaos?
Yeah, I mean, there's always a positive to find. And I think the positives we took from it were just how the community rallied around itself. And, at that time, I was the team doctor for our professional sports team. And, we had a game that night, actually. And, I remember the trainer texting me saying, hey, I know something's up. I hope you're okay. And if you can't make it, we understand, kind of thing. Like the team knew that things were going down, and they ended up canceling that game, of course, because we weren't going to have any gatherings after something like that. So the community rallied around that. There were many rallies at the soccer stadium, and the first game that we went back, I remember it was like hugely emotional. Like the fans at I think 22 minutes, because at that time 22 people had died in the shooting. At 22 minutes, all the lights in the stadium went out. And the only thing lighting was people's phones, and the players like kept playing. And it was like a really surreal moment. And, then finally one of our guys scored this, really amazing goal that I wrote about in the COA thing that I told you about. And it was just like this big release of like, okay, we're back kind of thing. So the city felt it, and they still talk about it. It's still something, obviously, I mean, it's a huge thing that affected the community and the physicians and nurses and staff involved. I mean, it's a mark that El Paso will never get over. It's always going to be remembered, and something that they're going to look back at. But there was a lot of positive from the community, the support. There was a guy who lost his wife. He was all alone. He had no family, and he lost his wife in the shooting. And like 300 people showed up for her funeral and like lined the streets around the church just to support this guy who nobody even knew. I mean, there are a lot of great stories like that came out of it. Great community.
I mean, it really does sound like a special community. Like, I mean, I think it says a lot from you to be able to speak so highly of it, being, you've been around. But I personally now got a pretty soft spot for the people of El Paso, just hearing all that they've gone through.
They're a very special group. And I used to tell people it reminded me a little bit of Canada, because I was working for a state hospital, which is a lot like Canadian healthcare, but it's a very multicultural, very accepting group of people. I mean, like I was telling you off camera, it's 80 to 90% Hispanic. I was the minority, but nobody cared. I mean, they treated me like anyone would. They were super nice and supportive, and I still talk to a lot of them. They still text me and email me and ask me how I'm doing, how my family is, and ask me advice. And I mean, it's a very unique place.
Yeah, I bet also, just speaking of family too, after these moments like these, like you hug wifey a little bit more, you hug the boys a little bit tighter. You know what I mean? It's one of those things that it's hard not to.
Yeah, it has impacts on all of us. Yeah, no, it does. And you're right. I mean, you appreciate that a little more. One of the stories that came out of that shooting was there was a couple and 3 of their children there. And, the father was shot shielding the mother and the baby. And the mother is the one I told you about. And she was shot shielding the baby, and the baby survived. They lost one of their other children, I believe, in the shooting. And the other child was just taken out by some stranger who it took them months to identify him, but he just grabbed the kid and saved him. And I mean, that's, I guess, just goes to show. There was another lady, there's so many stories like this. I could go on for hours, but one of the ladies that we treated, her shoulder was all blown open. Old lady, only spoke Spanish. And, I can understand enough Spanish to know what she was saying. And, she told us that she just remembers her husband shielding her, and she remembers looking at his face and knowing he was dead. And that was the last thing she remembered. And we just said, "You're safe now," and didn't know what else to say while we were putting her to sleep. Like, what do you do? It was a crazy, crazy day. And the stories, there are tons of them like that.
Yeah. I getting a little verklempt thinking about all these.
Well, I do too. I mean, it was a very emotional day, and you go into your doctor mode and you just do your job. But then you think about, that little old lady and, how she just told you that. It's crazy.
And I don't know what it is too about the idea of people really shield, like that instinct for people to just shield their family. And
there is a lot of stories
family.
of people
like
saving other people, not just family, just, you know, getting people out and throwing stuff at the shooter just to distract him, and, you know, people shielding their loved ones. And yeah, there's a lot of great stories that came out of it that are unfortunately sad as well, but just show like the power of the human spirit, I guess, you know, how we would like to just help each other, even if you're not family.
I mean, I guess part of that, hearing that too, is just kind of just warms my heart to that people, it's like you said, that human spirit, that looking out after each other.
I mean, that's how we are. And I think a lot of us deny it, but I think when it comes down to it, most of us would do that for, you know, somebody that you don't even know. I mean, it's another human being. And I think we need to remember that and get back to that. Like, just because you're not related or you don't know them doesn't mean you shouldn't help them. And anybody in need is somebody who you can help.
Yeah. And I think that if I'm being completely honest too, Bill, it's like when I think of COVID, this is probably why some of us, including myself, have been pretty adamant about trying to stick up for those that can't stick up for themselves, racialized communities, the children, and just
the people who are talking to their family on the iPad for the last time that you're doing. I know,
like, and just because
unimaginable,
like it just, someone needs to say something, and just to sit.
We all need to say something. That's the thing, I think. And, you know, this is a hot topic that I know is close to your heart too, but in orthopedics, we've been talking about the lack of women, the lack of minorities in orthopedics, and how can we fix that? And I think the greatest thing that I've heard so far about that is that the guys like me that are there, the old white guys, we're the ones that need to spur the change. You know, you can't do it all, and our colleagues can't do it all. They're already being held down. It's the people at the top that need to say, no, this is wrong, and we need to fix this, and we need to all be the same. I mean, we're not all the same, but we can all be treated the same.
Yeah, and as you we talked on a bit too, like having that level of diversity, like not just race, but sex, whatever, but like just diversity in general. Like you become stronger. You're more, your perspectives shifts. You see, you have that wider lens. And I honestly think it's, I mean, I don't know if you know this, but like I start up tomorrow as department head for
I
ICU.
did hear that. Congratulations on the podcast. And well deserved. Oh,
thanks, buddy.
But that's exactly what we mean. People like Quad need to be in charge to help remove some of these barriers for everyone.
Yeah, I mean, I won't lie to you. It definitely was a driver post. We're all woken up a little bit post George Floyd, but that was the thing for me, was like, you get a seat at the table, be able to advocate, and be a role model for many.
Well, you need to advocate, but everyone needs to advocate for you. And I think that's the key that came out of our discussions around orthopedics anyways, is that those people at the top are the ones that need to start the change. There are still many programs in the US that have no females, none. And that's unusual. And so those programs need to start somewhere, and it starts with the people making the decisions. Mm-hmm. And if you can get yourself into that position, or a female can get onto that committee, great. But until that time, the people that are there are the ones that need to do what's right. And that falls on everyone.
Amen, brother. Amen. Listen, Bill, you had me weeping during this call. You had me laughing.
You're never going to want me back.
This was like, I don't know. It just, like, I can't tell you how much this meant to me, actually, Bill, just because, one, I haven't seen you in a long time. Yeah. Two, just it made me really like miss you and wish that we could be closer.
I'm only a phone call away, brother.
I know, but it would be nice.
I agree. Like, it'd be nice to have a beer and shake hands and hug and see you and the kids too.
And the wife. Get the boys together. Get them together.
Too. Yeah. We need to do that.
Because I'm sure our boys are very similar in terms of energy.
It's going to be trouble. Yeah.
Also, like, just to hear the stuff that you've gone through in terms of real life, like you being there in El Paso, hearing those stories, hearing the COVID response. Like, I learned a ton. I miss you.
I miss you too, buddy. I got to tell one story though.
Oh yeah, shit.
I told you.
Yeah.
And we can do this. We can revisit in a few months too. I don't have that much on my schedule, but I needed to tell a story about you that I still tell, and you don't remember this, I'm sure. But I was a senior ortho on call. You were the senior in the ICU. I had just done my rotation. Kwadwo is God kind of thing. And you called me one day and you were like, Bill, this is going to sound crazy. And I was like, okay, Quad, I expect this kind of thing from you. He's like, you got to come aspirate a knee. And I was like, okay, that doesn't sound that crazy. And then you were like, well, we're currently calling a code on her. And I was like, what? And you're like, listen, it's the only possible source we have. I need to see if this is the problem or not. So me and the junior, ran up there and I told the junior, like, listen, I'm just going to do this because this is a critical situation. Quad is doing a code on this patient. And you guys were literally doing compressions. And I walked in, I was like, Quad, you still want me to do this? And you were like, yeah, I mean, we need to know, and we don't have a source yet, and we're doing everything else. So if you can do it, do it. And so I aspirated this knee while you guys were doing compressions. And I still tell that story of like, wow, like that was crazy. But I mean, I guess, it needed to be done. You needed an answer. And
oh my goodness. I totally don't remember that.
No, I'm sure you were obviously thinking of other things like running a code and all that. And you were running the ICU. So I'm sure that wasn't your only sick patient. Oh, but, man. It's just like crazy things that happen in medicine story.
Absolutely. That's a legend. I love it.
Yeah, I still tell residents about, aspirating a knee while they were doing compressions.
It does sound a bit crazy, but
I mean, it was justified. And I mean, I wouldn't have done it and you wouldn't have asked if we didn't need that answer.
Yeah.
And unfortunately, I don't think it helped. But at that point, you're just trying to do everything you could to help that patient. And that's what we were doing to help you.
Yeah, sometimes thinking outside the box a bit, I like to try and teach that to the kids for sure.
Yeah, you had your reasons to ask me to do it. Don't ever think that it wasn't justified. It absolutely was. Just the circumstances were a little unique.
Yeah, absolutely. Buddy, we're going to do this again for sure.
Let me know. Amazing. I mean, I'm just a Zoom call away and we'll keep in touch. I'll keep listening to the podcast. You're doing great work. I really enjoy it. I'm trying to push it to, my friends and colleagues up there in particular, because you're raising a lot of talk about issues that need to be discussed. And that's, I think, the best way to approach them. So I love it. You're doing great work, buddy. Great work.
You too, man. Thank you so much. And hey, look, I'll be looking you up. We'll be definitely making a trip to Texas.
Come on down. Yeah, come on down. We got room. We got a beach. We got ocean.
Oh, man.
Ocean. It's not the prettiest ocean, but it ain't bad. Yeah, it's an island. It's got palm trees and stuff.
Oh, I love it.
Yeah, you'll love it. And we're just south of Houston. You fly into Houston, we'll come get you.
Beautiful. Thanks, my friend. Quadcast Nation, what can I say? I was truly moved by that conversation with my boy, Dr. Bill Weiss. I hope you enjoyed it as much as I did. Follow us on Instagram, YouTube, Facebook at Quadcast. Leave a 5-star rating on iTunes. Help us change that boogie. Leave a review. You know what I'm saying? It all helps, for real. Leave any comments at quadcast99@gmail.com. Check out our Sullivan Wellness platform. Oh man, $99 for the year, $9.99 for the month. Just trying to reduce burnout amongst our healthcare providers. We're doing this together, people. SullivanWellness.com. Thank you so much for listening. We're going to connect again real soon. Peace.